Hello everyone, Reflect and Reset with Maria
and Gina. Of course, you know us by now. We don't have to keep doing this thing.
Well, for those that don't know us, because we get new followers.
That's right, we have a lot
We're
more
getting
followers,
a lot more followers, so we have to make sure you know what you're doing with us today. So Reflect and Reset with Maria and Gina, your favorite show every Wednesday, and we're changing things around a little bit.
See, I'm not in my seat. I'm not in the hot seat. She's in the hot seat.
So Gina is going to introduce our wonderful guest today.
Yes, so this is Dr. David Rosenzweig, who is a doctor of podiatric medicine. And Dr. Rosenzweig actually works out of our office on every other Tuesday, but we're going to try to get him here more often. And he also works in Rybrook. So we're going to talk. Hi, welcome to our show.
Thank you for having me. Nice
Tell
to be
us
here.
a little bit about yourself and give us a little background on you.
Sure. I've been a podiatrist for going on 36 years now.
You don't look like you could have
Thank
been.
you very much. And
He's not even using our aesthetic center yet.
There you go.
Ooh, we're going to talk about that.
Yeah. I treat all ailments related to the foot and ankle. And it's a very relevant area, especially with an aging population, that they say the foot is the mirror of the soul. And it's incredible how many diseases can be diagnosed first in the foot. So we don't take it for granted.
That's like the reflexology with the foot when they do all the pressure points really touches your whole body.
Yeah, similar, but not quite the same concept, but yes. And we see a lot of diabetics in this aging population, and certainly here in the Formé setup. And
Why is it that diabetics need to see you every 3 months?
that's a great question. Diabetics have a tendency to develop what's called neuropathy. Neuropathy is where they lose feeling. They lose feeling in their feet, and unbeknownst to them, they can develop an infection, which can become devastating within 24 hours, prompting potential loss of toe, foot, or even leg, and subsequently even to life. So the morbidity and mortality with diabetes is extremely high, so preventative measures are really the key. And that's what we promote, and that's why we want patients to come in on a regular basis for inspection and coaching as much as anything else.
And it's even the nail part. I mean,
Sure.
you manicure that nail part because that can get infected so easily.
Absolutely. Well, the thing we see most frequently is fungal involvement of the nails, and I'm sure a lot of people out there in their own self or family where the nail can get yellow, it can get thick, it can get ingrown, which can lead to a bacterial infection. I have a little thing here, it's kind of rudimentary. But if you see redness, if you see swelling, if you see pus around the nail, you do need to go see your doctor or podiatrist and have it evaluated quickly, because it can morph into something pretty significant, and we try to avoid that.
Let me ask you, so people go to the nail salon. Like if I was a diabetic, should I go to the nail salon to do my pedicure?
That's a great question. I usually use discretion on giving people green light who are diabetic to go to nail salons. My general rule is no. Because sometimes in nail salons they try to be a little too aggressive, and people who do have fungal and ingrown toenails, they try to be a little too aggressive, and people end up with an infection.
It's also the sterilizing. They got to make sure that they're really sterilizing based on the Department of Health standards.
Absolutely. I don't think many of them do that. I think they've gotten better. And I go for manicures periodically, and I speak to the women, and I see them taking instruments out, but I don't see them autoclave them. Right? When we have instruments here, we autoclave after every session.
Right.
By the way, I've noticed that because normally when you autoclave them, the bag is wrinkled.
Well, it changes color.
It changes color, and I don't see that.
Right, they just open
I think
these
that's a
bags.
head fake between you and me.
Yeah.
So one of the things you can do is bring your own instruments to the nail salon,
Yeah, I have my own.
dedicated to you,
Yeah.
not anybody else, because communicable diseases can be transferred through instrumentation, right? If you have an infection or you have something, your DNA gets on the thing and then goes to the next 3 people. Anything can happen. So you have to be careful with that.
Yeah.
I'm surprised there's not like more hepatitis things being
I
transmitted.
don't think you hear about it. I think that
Maybe
there
you don't
probably
hear it.
is,
Yeah.
and you're just not hearing about it.
You hear about it when it happens on a grand scale. I
Right.
think in California
In a
a
restaurant.
number of years ago, correct, right,
Right.
when people get sick.
Yeah.
I think in California a number of years ago, they had an enormous problem, and they changed the rules, where you have to put a plastic liner in
Right.
the tub,
Which they
all
do
of that came
Yeah.
out of those sorts of things. And they're supposed to be autoclaving instruments. Again, I'm not sure that they're always doing it, so
Yeah.
be careful is the rule.
Yeah.
So Dr. Rosenzweig has been, actually treated my daughter for a year, I think it was, for those planters warts,
Right.
that's what they're called.
Okay, so it's
And
difficult to
oh
get
my
rid of.
God,
It's the
it was
shaving,
so
shave,
difficult to
shave.
get rid of them. Finally, after 2 years, really, because for about a year I was trying to do it,
On
you
yourself,
know,
on your own.
just ourselves. But it got to the point where they kept getting, as you saw, worse and worse. And it was coming to you every 2 weeks, and it took 1 year.
Warts are
How do you
very-
prevent warts?
A few little things, and kids and adults are prone to warts. Avoid barefoot walking, even in your own home. Wearing flip-flops, wearing sandals, socks. Wart virus is transmittable. We don't know what it looks like. I describe warts as the common cold of skin. Okay, just like you get a cold. Do you ever know where you got it? No.
No.
And all of a sudden, your nose is running, you're coughing, you feel miserable for a couple of days or a week. Same is true.
Is it a bacteria that's on the floor?
It's viral.
It's a viral.
It's viral. So viruses are very difficult. You know, you don't know what virus looks like.
Right.
But invariably, it's on surfaces, showers, on your floor if you're out. One of the ways that we all get inoculated is if you step on a splinter or a little something that penetrates the skin. Lo and behold, a few weeks later, you end up getting a wart.
Oh
there.
wow, I didn't
So
think of that.
that can be the mode of transmission. That's how you get inoculated, because it weakens the skin, and the wart is sort of an opportunist, and you end up with a wart in that spot. And like you learned with your daughter, it started as 1, and before you know it, she had 50.
Right.
Yeah.
And it was a long struggle of constant, attention, both here and at home, to finally get rid of it.
And you could also get it, because she had one in the thumb, which one of the dermatologists here treated it, and that was pretty ugly too, because
They're hard, and they recover.
I think you give on the face too, those stepmother warts that come out.
Did you?
I get one every once in a while with my stepsons.
You get one?
But you can
the
actually,
comedian.
I think it's great because you really can get it
them
anywhere. Anywhere. Yeah.
Anywhere.
Yep.
Yeah.
Wow.
And what's the difference between like fungus on the feet and like an athlete's foot?
It's exactly the same thing.
It is,
believe
so
it or not. Fungus anywhere you've heard of, ringworm,
Yeah.
tinea versicolor, they're all the same thing in different parts of the body. It's the same, they're not even bugs, they're lower life than bugs. It's the same organisms that are causing that.
And that's from dirty showers and again walking on the floor.
And
You
it
can
can,
get it from
sure,
anywhere.
and think of it, at least on the foot, think of feet in shoes many hours a day. It's dark, it's warm, and it's moist. It's the perfect environment to breed fungal development, right?
Yeah.
It's like you go on vacation and you leave a bread on the counter. What happens? You come back and you have a science experiment on it, right? With stuff growing on it, or in your refrigerator, you open a thing of sour cream that you haven't opened for 3 months, and it's got
Yeah,
things
little-
going on.
little visitors in there.
Think of your foot in a shoe, and if you're active, you go to the gym, hot weather like this, where it's in the 90s day in and day out, it's a perfect breeding ground for fungus.
And you know what I wanted to say real fast is that what people don't understand is they think of a podiatrist as your foot. It's not just your foot, guys. It's from the kneecap down.
Just below the knee down?
Just
Yes.
below the knee down.
Absolutely.
So all
calf,
these injuries,
ankle,
right? You don't have to run to an orthopedist. Your
that's what we treat.
local neighborhood podiatrist can take care of all
Fractures,
that.
infections, surgical corrections, preventative measures, skin, nerve, bone.
Calves, you said.
Calf injuries, it's interesting. This morning in my other office, I saw 3 people with ankle injuries. And it's funny how things come in sort of serially. Last week we had fractured toes. And one day we
What
had
do you
4
do
people
with
with
the
fractured
toe?
toes.
That
Usually there's not too much to do, unless it's really out of alignment. If the bones are really separated. What I sometimes have to do is numb it up and put it back in position. It's rare that I have to operate and put a pin or something in.
So what's the difference between what you do and what an orthopedist that concentrates on foot and ankle does?
Almost identical.
Almost identical.
Yep, absolutely. But I think our area is a little more comprehensive in that many orthopedic foot and ankle specialists don't want to deal with skin or nail. They don't want to deal with infection. Wound care has become a very big area in podiatric medicine in the last 15, 20 years. Again, dealing with diabetes, as you mentioned earlier. Most of those docs want nothing to do with that. So we as a profession cover everything related to foot and ankle.
So if you have a pain in your foot, then you should come, do people come directly to you, or do they go?
Absolutely, absolutely. Yeah.
Okay.
Let's talk about heel pain. Heel pain is one of the most common things I see in general, and in this environment here at Formé, one of the most common things I see.
I remember talking to you because we have a lot of Latino patients and people that work many jobs where they're standing, and you were telling me that.
Absolutely. I was mentioning that to Gina just before, that in this environment, people who work in construction, who work in restaurants, people who clean houses, they're on your feet all day.
Yeah.
And if you have a susceptible foot type, if you don't wear the right shoes, guess what? You end up with heel pain, and it's really stubborn.
Yeah.
What happens? So I wear heels. I'm like the heel queen, and I'm hoping to be able to wear them until I'm, very old. What is your?
Well, heels, needless to say, should be worn with discretion. How's that? Because you put the foot at a higher angle, you put more pressure on the ball of the foot. If you ever saw how wide your shoe is relative to your foot, you'd be amazed. It's literally like, I took 3 fingers and put it up against 4 or 5 fingers, that you're literally putting 5 quarts in a 4-quart container. So you're squeezing your foot.
Yeah.
And if you have pre-existing conditions for bunion, for hammer toes, all of those things will be
Or
exacerbated.
corns.
Well,
Get the corns on my
corns develop on toes.
Yeah, I have
That's
that.
one of the most common.
crooked.
Yeah, and they're so
Absolutely.
ugly.
The corn is a thickening of skin. It's the body's defense mechanism against chronic irritation. Okay? If your toes get crooked and you're in a high heel that's tight, there's rubbing going on. Sort of think about when you first started writing, or if you play tennis or golf, you start getting calluses on your hands. That's exactly what's going on your toes. And lo and behold, they can start getting painful because they get thicker, the tissue underneath gets irritated, and really the only way to make that go away is to straighten the toe. We have to do a little procedure where we remove a little piece of bone and straighten the toe, and the corn goes away.
And what's the recovery for that?
Recovery on that, it takes a couple of weeks. Most people are in a little surgical shoe or a sandal or something for about 2 or 3 weeks. It's sore for the better part of 6 weeks.
You used to be able to get that stuff from CVS, and you put it on there, and
We discourage the use of that because that doesn't really address the problem.
okay.
If you want to put a non-medicated pad to protect it, that's fine. But having it trimmed, having it covered is the non-surgical way of doing it, and most people do very well with that. It's only when you decide, this is not working anymore, that we start talking about surgical intervention. And for a lot of people, it gives them the relief they're looking for.
What about gout? Can we talk about gout?
Sure. Gout is, we see gout mostly in men, but occasionally in women. And it's
Why is that?
just the metabolic preference of male versus female. And gout is a sort of a breakdown in the purine metabolism, or protein breakdown in the body. So instead of it being washed out through your urine, it metabolizes and it precipitates in joints. The big toe joint is a very common area.
Yeah.
And what happens, and it's almost unmistakable, people come in and just say, I felt this pain at 3:30 a.m. It woke me up from my sleep. And they come in with a swollen toe, it's hot red swollen. They won't even let you touch it or move it. I mean, you don't even have to do any diagnostic workup. You know that's
They say my father used to get it when he had seafood.
Well,
Is that like
allegedly,
a trigger?
It certainly can be. Crustaceans and mollusks can be a precipitant of that. the theory was guys who were, you know, hefty back in the day, eating steaks and lamb chops and pate and all sorts of organ meats, had a higher risk of gout, which they probably did. But the diet connection is really just theory. It's not absolute documentation.
Okay.
So the key is you need a blood test. Uric acid often is elevated, so that's where the medical doctor has to be involved as well. There are products that lower uric acid in the body, not unlike taking medication for high blood pressure. And I am a strong advocate of people taking those medicines because those flare-ups are not fun. It often requires a cortisone injection, anti-inflammatories, maybe even oral cortisone for a number of days to get it under control. It's not fun. So if you can reduce or eliminate those flare-ups, you're way ahead of the game.
And what about, I know you handle plantar fasciitis,
Sure.
right? And maybe we can just talk about what that is, because you also, there's the system, the extracorporeal shockwave therapy that you do, don't you?
I do.
And I know that when I first had Formé rehabilitation, we used to come and work with you for our patients that had this issue with their foot, and this was experimental, if you will. It works for gallstones. It breaks the gallstones, but this is heavy ultrasound that actually, I guess you can explain it, actually cures.
Well, let's talk about what plantar fasciitis is. Otherwise known in most circles as heel pain.
Oh, that's the heel pain.
Or heel spur syndrome.
Yeah, I think about it more on the instep, the plantar fasciitis, isn't it?
Well, you know what, more often than not, it's based in and around the heel. It can be in the arch also. But more often than not, it's around the heel. And again, as we talked about, people who work on their feet have a higher incidence of foot pain and heel pain, primarily. And it's very sneaky. It's sore in the morning when you first step out of bed for the first couple of minutes, maybe 5-10 minutes, and then it resolves. And most people are okay during the day. Later in the day, they start to get a little sore. And they think, okay, it's gone. The next morning, it's there again. So it sort of is stubborn, it's recurring. It's an inflammation of the thick connective tissue underneath the heel. For this population, cortisone injections, anti-inflammatories, wearing better shoes and sneakers, insoles, over the counter is usually what we start with because they're far less expensive. Stretching, ice, all those sorts of things work in most cases. How long does it take to get better? It's hard to say.
Physical therapy, I know you used to send them all to PT.
And physical therapy, absolutely. It's a process, and you have to work at it. You mentioned extracorporeal shockwave therapy. It is a technique that has been around probably the better part of 15 years now, and I feel like the guy in the hair club. I got involved in doing it because I had chronic Achilles tendonitis that I could not get rid of with conventional modalities. Physical therapy, a walking cast. I literally was ready to have surgery when that came out. I had a handful of treatments, never had a problem again.
Wow.
Because they're doing it for tennis elbow, golf, the golfers. I think I sent you a couple of people for the golf. I know it's, maybe I'm not supposed to say that because it's podiatrist, but you have the machine,
Right.
and it works.
And it does work. Yep.
It works.
Absolutely.
It helps Lewis and Al.
Yep.
Yeah.
And it is indicated for areas in the elbow, the shoulder. Docs are using it on back issues.
And it's still
hip
not covered
issues.
by insurance?
It's still not covered by insurance.
Doesn't make any
It was
sense.
covered early on, and then they went into this experimental mode and have not come out of it.
Yeah.
But it is very effective, and I offer to people when they first come in, but more often than not, it's a last resort.
Yes.
If conventional modalities with injections and therapy and everything else doesn't work before having surgery, it is definitely a very viable, non-invasive option. And I've been very happy with it, and I think it's probably
You're getting a lot of good
90%
results.
plus
Yeah.
success rate.
Wow.
Because
Yeah.
most people don't want to have surgery, and I don't blame them.
Yeah.
I mean, foot surgery, it's a long process to recover, and it affects you in so many ways.
Absolutely. Well, taking you out of your shoes is
Yeah.
a big commitment.
Yeah.
So if we can treat and resolve things conservatively, we always try. No question.
So I'm going to ask your advice because, as you probably know, I'm running the New York City Marathon.
We need some people to donate. We need to donate. We need to raise
Awesome.
$30,000 for this woman.
Yes.
Actually, not for this woman.
Yeah.
On behalf of this woman, for the
Leukemia and Lymphoma
Oh,
Association.
pediatric research.
And I have to say, on a side note, I am amazed because I've been contacting a lot of my friends and people that I know that I'm seeing so many people write back and say, my friend's daughter, everybody,
Yeah.
it looks like so many people are being affected by this disease. So I'm running for a good cause, but it's definitely a challenge. As I wrote on my post, you know, I don't have limits. I look at limits and I want to get to that place. And to me, running the New York City Marathon, 26.2 miles, is definitely a challenge.
It's a great event.
And
I've done it before.
You've done it before. So
How's your training coming?
it's I was just gonna ask you. So I realized that I wasn't really doing all the things that the runners do with the salt, with the goo, and I was cramping
Okay.
a lot. And every week I would come to Gina yesterday.
Oh, yeah.
She's like, "You're falling apart." So I'm like, "How am I gonna run this if every week I'm getting hurt?" And it's my calves. They're in the hamstring. I was tightening
At night or when you run?
during the run. So I mean, I realize now I have a better routine. I spoke with my coach and I spoke with my son, who is also running
Okay.
with us.
So what they advise for you to do?
I'm supposed to take this salt, base salt, I think it is,
Okay.
every mile. And there's a little
Is it a drink or
powder.
tablet?
Is a
Oh, it's
powder. And then there is goo is after 5 miles. There is it's a whole routine. Gatorade. You're supposed to hydrate with Gatorade. I was running 5 miles and I wasn't drinking any water or anything. I just kept going for 5 miles.
Right.
And then at the end, my calves were so tight, and then it would take me days for my calves to recover.
Right.
So then I would go try to run again, and my calves will go in.
Are you stretching your calves and hamstrings?
I am stretching like 5-10 minutes before I run.
How about after you run?
After I run too.
Good. And even on day, you should be stretching several times a day, actually.
Yeah, I'm beginning to
Yep.
see that. But what was your advice like for my feet? Like, how do I protect my feet for injury?
Make sure you have a good pair of running shoes. That's
I went to
proper
the
for your
store and
foot.
they,
Okay. There are better stores
yeah.
that know how to fit. It isn't arbitrary like going to Modell's or
No,
or
Westchester
yeah.
Road
from
Runner,
Zappos,
places like
some of
that.
the Anthony Wright, Westchester Road Runner locally.
Mhm.
And
I went
there are
there.
several other good stores. Start with that. Maybe you need a better insole versus what comes with the shoe, even with a good, expensive running shoe. Stretching, very important. And you have to build up slowly.
Yeah.
I think the mistake that many people make is that they build up too quickly, and they get them, then they break down, and they
Yeah.
get
Well,
injured.
she thinks that she can run 26 miles right now. That's the difference between Maria and me. I know I can't even run a mile. And I'm good with that.
That's okay. That's okay.
I am learning to
Mind
be
over
patient.
that. Mind over calf grip.
There you go.
I am definitely learning to be patient.
Massage, baths,
Mm.
hot tub, all that to keep your muscles as limber as possible. Warm up slowly. Do some biking in between. Do some cross training.
Yeah, I'm gonna use the physical therapy
Yeah.
place here and start doing some biking,
Good,
but
good.
it's
And
definitely,
even, we have a physical therapist right here. He should be doing some manual therapy on your feet.
Let him check your flexibility too.
okay.
Yeah.
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 Well, this was actually, believe it or not,
This is
we're,
great.
we're ending. It's 30 minutes. That
Wow.
time flies when you're having
Absolutely.
fun, but we cover so many
Yeah.
different issues that you can have with your feet, and
And we only touched on
a few.
a
Yeah.
handful.
Yeah,
Few little things before we go.
yes.
The feet have half of the bones in the body. Half of the human bones are found in both feet,
Oh,
believe
wow.
it or not.
Wow.
So that's,
Because you're tiny little.
well, there's 26 bones in
Wow.
each foot.
Wow.
There's roughly a little over 100 bones in the body. 50 plus are in the feet.
Wow.
So you realize what an intricate design it is. And if you've ever been into, you look at buildings, you look at architecture, if you've been to Europe and you see how they use stone and how they wedge it, the foot is designed like that. It's incredible. Nature did such an amazing job. But that said, wearing good running shoes and doing all these other things is still critical to not getting injured.
I smile because I am very, I say that passion is contagious. And no matter what you do in life, because I was going to say, why did you choose to be a foot doctor?
I fractured metatarsals on both feet as a kid playing basketball, and my good friend's dad was a podiatrist, and I
developed a love for it.
sort of cut my teeth on my own injuries and realized it was a diverse area, doing sports medicine and doing surgery, and it's worked out well.
Yeah. Well, I love your passion. From the moment that I met him, and I've known him now for quite a while,
Absolutely.
quite a few years. And the passion, you see that no matter what you do, even if it's taking care of feet, you have so much passion that you make it interesting, because you've made this show quite interesting, and we want to thank you for joining us. This has been so much fun.
And let everybody know that you can see Dr. Rosenzweig here or in his office in Rye, so you can call us and get some more information on how to get a hold of him.
Yes, and remember to like us, because I know that you're watching. So
Like
us, okay?
With Maria and Gina.
Nice.
Take care,
See you next
guys.
week.
Have a good day.
Bye-bye.
Bye.